In the previous video, I illustrated the difference between side and adverse effects. And here in this video, I'm showing adverse effects classification, different subtypes, and how each one of them can be managed. Now take your breath and continue. Adverse effects' best and most famous classification is the ABCDE classification. Each letter refers to a word. That word summarizes the features of each subtype. A type refers to augmented type adverse drug reactions that increase by the dose increase. For example, the more you take aspirin or any other agents in the family of non-steroidal, the more you are susceptible to develop stomach ulcers or kidney damage. Ulcers and renal failure here are augmented drug reactions. Type A adverse effects can be prevented by dose reduction or by using other drugs that are more safe. Second type is type B. Type B refers to Bizzare adverse effects that are the most spontaneous, unexplained, and mysterious subtype of adverse effects with no certain pathway. An example for type B adverse effects is anaphylactic shock caused by penicillin injections. Anaphylaxis is only prevented by not taking penicillin if the patient is sensitive to it. Third type in that classification, in the ABCDE classification, is C-type. That refers to continuous use effects that come clear by misusing drugs and the prolongation of drug durations than the patients asked. C-type occurs when a patient continues to take certain drugs while he or she are advised to stop. For example, when a doctor advises a patient in a certain condition to take corticosteroids for just 2 weeks, but the patient feels good and comfort taking the drug, so continue using corticosteroids for more than 2 weeks. That supposes him or her to experience Cushing syndrome as a result of continue using corticosteroids for more than asked. To prevent type C continuous use adverse effects, all what you need to do is just strongly advise the patient to follow instructions and not exceed the drug use duration for more than advised. Type D is to delayed effects that appear after months or years of drug use. And the nearest example to mind is drugs in pregnancy. In 1957, when pregnant women who used thalidomide and after months of use, they got babies with permanent birth defects. Also, an example for D-type adverse effects is radioactive iodine. Radioactive iodine is a therapy for thyrotoxicosis, but research found that radioactive iodine induces cancer after 30 years from therapy start. To prevent type D, delayed adverse effects is like type B, Bizzare reactions. All you need to do is to find other options and avoid these drugs as possible, or use under medical supervision. When consider risk-benefit ratio to thalidomide, for example, you will find its very minimum benefit against very harmful damage. So, thalidomide in pregnancy was with a very high risk-benefit ratio. Risk is higher than benefits by many times. Last type in that classification is type E adverse effects. That's connected to end of use, like morphine and caffeine. Morphine addictive persons, when they suddenly stop taking their normal doses of morphine, they feel of intolerable, severe pain in all parts in their bodies. Also, caffeine sudden stop may experience persons to migraine attacks and severe headaches. To prevent type E end-of-use adverse effects, drugs that are known to induce type E effects must be gradually withdrawn from the body. As a summary for all what I said, type A reactions are augmented effects connected to dose and avoided by dose adjustment. Type B Bizzare effects, that's better to be avoided, or just use these drugs under close monitoring if those drugs are showing high benefits against risks in risk-benefit ratio. Type C adverse effects refers to chronic continuous use and prevented by following limited time of drug use and following doctor's instructions. Type D is delayed reactions prevented under medical supervision to detect the best time of use and the risk-benefit ratio. Type E adverse effects are for end-of-use reactions when certain drugs are suddenly stopped. And type E reactions are prevented by gradual stop of these drugs.